Well, welcome back to another episode of The Compass with Dr. Brad Robinson. Today, it's going to be an amazing conversation because we're talking about something that there's a lot of information, misinformation about, and that's anxiety and anxiety disorders and the difference between what is what and how it manifests in children. And so, can you, Dr. Brad, give us just a brief summary as you were meeting maybe with a parent and they bring their kid in and say, "Hey, I think my child's suffering from anxiety." And then what do you have to go through to sort out what's what?
Yeah. Yeah. Anxiety disorders are really one of the most common, things that, you know, kids present or parents bring their kids in to see a pediatrician or a psychiatrist and really are concerned about. I think there's a lot of reasons for that because I think, anxiety in general is a normal emotion and it's there's various stages of development where some degree of anxiety, or we use the term anxiety, our 1-year-old grandson's starting to have a little bit of that stranger anxiety, where he's beginning to really be able to distinguish family from people that he doesn't know, and he's a little anxious and but that's a normal stage of development, and I guess even that there's degrees on the bell, on a bell-shaped curve of more extreme forms of that. Um, but all through development with kids, there's various stages of life, stages of development where there may be normal, healthy amounts of anxiety. Separation anxiety is a common one, where the kids really struggle separating from the attachment figure, the secure based parent, and there's an element of that that's normal and healthy, to a point, but it's, as with most things, it's really all about the degrees away from kind of a baseline and the impact that the severity of the symptoms have on social interactions and child development. A lot of things. And I guess what I have in my mind right now, which is the area, I mean, we can talk about adolescence here in a minute, but in the younger age, the preschool and the elementary age kids, lots and lots of visits, to pediatricians and psychiatrists sometimes because of various concerns about anxiety. And so I think that, that's definitely worth exploring. I'm sure, folks watching, have had experiences with their own kids or may have questions about, well, how do we really navigate that, with a kid? And, I think maybe a starting point is to define a little more about some of the categories of what we would call anxiety disorders. And
I was
then
going to say, because before we got started, you labeled separation anxiety, phobia, general anxiety, panic disorder, panic attack, agoraphobia. Like there's all these different categories, right?
right. Yeah. Yeah, exactly. And so, yeah, if you look in the DSM, I mean, yes, there's, so, well, I mean, just flip it open here because it goes right down the list of, separation anxiety. And again, separation anxiety in a sense is a at times developmentally normal, but really if it's getting to the point that it's, a kid is having trouble maintaining at school or, missing days of school for any length of time, then it's starting to cause developmental, problems. And so, separation anxiety, according to DSM, is just a, developmentally appropriate or excessive amount of fear or
Mm-hmm.
concern when separating from a primary attachment figure. And then there are a list of, criterion symptoms along those lines. Um, and then, and we'll maybe come back to some of these, but then, yeah, Other types of anxiety disorder, specific phobias, the more classic, fear of spiders or snakes, or one of the ones that I know pediatricians see real commonly. Back when I was doing peds, it was pretty common, specific phobia, that a lot of times was treated by the pediatricians, was choking fears. Because it's not uncommon for a kid to, choke on a piece of food, or back when I was doing peds, it seems like, it wasn't huge, it wasn't real frequent, but enough, you get used to it as a pediatrician. You have a kid coming in, 2, 3, 4 kids a year will come in, and they've been sucking on a popsicle or something, and had maybe stumbled and had a fall and kind of jabbed the back of their throat, and there may have been a little bit of a traumatic injury to the throat, and then there's this this phobic reaction that develops around fear of choking or something along those lines. So that's a you hear about, or kind of people talk about, oh, fear of spiders, fear of snakes, whatever, but actually I think one of the more common ones, at least clinically, I don't know if that matches with research data, but clinically, one of the ones that I see a fair amount that people don't think about is stuff like that, where kids had an injury, or choked on some food, and then it kind of it sets up this pattern of fearfulness to the point that it starts to get in the way. They don't want to eat. They don't want to, and that can be a problem. It's usually fairly simply treated. Pediatricians, do some exams and make sure that everything's fine, and reassure the child and reassure the parent, and do some progressive, desensitization. And usually it's fairly easily treated, but it's an example of a common specific phobia that kids may have. Social anxiety is one of the next ones on the list that is a real disorder. I mean, it real disorder in that there is specific data, consistency in the diagnostic criteria, and consistent impairment of functioning. Now, everybody has experienced a little bit of social anxiety. I think, you get up in a large crowd and you've got to do a speech, or you're in a room with a lot of people, and you're talking loud, and suddenly realize that the speakers walked in, and then all of a sudden all the eyes are on you because you hadn't noticed it, and you're still, and it triggers social anxiety, right? I mean, it's, or
I was at a church service the other day, and the chorus was over, and they kept repeating it, but then they didn't repeat it this time, and one girl started singing the chorus again really loud, and then she was really embarrassed. She started laughing.
Oh yeah, exactly. Yeah, it's just that kind of embarrassment, social anxiety. And so much of that's normal, but just for people to understand, so you think about that, and then turn the dial up 100-fold, and you begin to get a sense of an intensity of that, even in just normal situations, walking into class, and even though all eyes are not on you, but your anxiety system triggers and goes off, everybody's watching me, everybody's talking about me, everybody's, sees that I have a pimple today. I mean, that, that's the common adolescent one, or whatever. And it can get to the point that it is really disrupting functioning, and that's when it rises, more to that level of a disorder. Panic disorder, panic disorder is another one that can definitely happen in young children as well. And it's, there are times that we have, the simplest form of panic, not necessarily a disorder, is kind of the beginnings of a startle response. When you come through an intersection. I mean, this is an adult example, I guess, obviously, but you come through an intersection, and then somebody's coming and doesn't see the red light, and it slams on their brakes and it's a near miss, but there's this startle response, and you may get a little bit of elevated heart rate and that sort of thing. Well, panic is just sort of that, but it's a continuation, and it can definitely happen in kids. And it's that I often say it's, panic is that, your body and your emotions react like the lion's about to eat you, but you look around and there's no lion. And the thing about panic in older children, adolescents, and adults, one of the hallmark features of panic is that cognitively the person understands. They're like, yeah, I know there's no lion. It's like, I'm not, I look around, I know there's no lion, but I cannot make my body physiologically stop reacting in that way. And it may take 5 minutes, 10 minutes, 15 minutes or longer to down regulate all of that. And that definitely happens in kids too. And in younger kids, sometimes they really have difficulty just because of their developmental age. They have difficulty identifying and don't really understand it, can't put it into words, and don't know that the lion's not about to eat them, or can't, they just like, yeah, something bad's about to happen, and they're just in a panic.
Would you describe it as like a sense of impending doom?
Yeah,
they can't shake?
Yeah, definitely a sense of impending doom that you can't shake, and those kinds of aspects are, a big part of panic disorder. And we're just doing a real quick survey, but generalized anxiety disorder is it's kind of like it says, it's a more generalized in kids, to some extent in adults. I mean, this is an oversimplification of the list of criterion symptoms, but in kids especially, generalized anxiety disorder is what I call the classic what if worries. It's this, we all do that a little bit, our mind will kind of go and we'll begin to, what if this, what if this place on my arm really is cancer? Okay. Well, no, wait a minute. That's just, I scratched that the other day. That's not, what if, what if,
it's almost like you're living in that what if as if it's a reality.
Yeah, exactly. And kids do that. Young kids can do that. What if I get, called on? What if I don't do well in my schoolwork? What if I get an F? I mean, they're a straight A student, but oh my gosh, what if I don't pass this? What if what if something happens? It usually runs in kind of groups or clusters. So it may be like academic kinds of things, or it may be, oh, what if I get in a wreck? What if I get abducted? And, what if somebody breaks in? What if something happens to mom and dad? What if, and it's this what if, and just not able to settle it down, and get it to calm. So, yeah, from that perspective, I think that's a big part of what the generalized anxiety, kinds of symptoms are. And it can be associated with, difficulty concentrating. It can be associated with irritability. A lot of these anxiety disorders can be. And so, I mean, that's just a quick overview, but like one of the things that I think is helpful for parents to know too is to go back to a little more of like, well, what's actually going on with an anxiety disorder. And one of the things to sort out is that anxiety disorders are complex, and that list of anxiety disorders, and that was one of the reasons for giving that list. Sometimes I don't worry too much about labels, but that was one of the reasons for giving that list, is that list, it does provide a little bit of a continuum of physiologic panic and psychological worry
Yep.
and the overlap. And so that's something for parents to sort out and to kind of watch for. So on one end of that spectrum is panic, and a pure panic disorder is very physiologic. I mean, there may be a psychological trigger. There may be a thought that, that sets it off, but sometimes there's not. There's not a thought at all. There's not, and it's just a physiologic reaction. And we did something on panic once before. I think we were focusing more on adults, but I talked about it then. I often even prefer the term autonomic instability when I'm talking with adults about it over panic, because it helps them get in their mind that what we're really talking about is the autonomic nervous system and the fact that it is unstable. It's not regulating right or appropriately. And it really is pretty disconnected from psychological worry. It's a physiologic reaction. And so then you begin to move into other things that separation anxiety, social anxiety, for example, they are psychological worries. Stranger anxiety is, that's a very young child, but in developmentally, they're just kind of beginning to recognize safety, secure parents, people I know, people I don't know, that's a threat. So it probably doesn't with a very young child, a 1-year-old, it may not psychologically go much more than that, but there is a psychological component in that regard. And then they may react physiologically, tears and crying and upset. Separation anxiety, the same way. There's a sense of, oh my gosh, something bad is likely to happen if I am separated from my primary attachment figures. Something bad is going to happen. And then, so that's the psychological pattern, but then it may trigger panic type symptoms physiologically, autonomic, hyperarousal and all of that. And then you kind of move on the spectrum and you get over to the other side, and you get to generalized anxiety disorder. And generalized anxiety disorder, I would say, sort of almost flips in that generalized anxiety disorder is there's a lot of psychological worry. What if this is going to happen? What if that's going to happen? And the thoughts and the worry thoughts and the worry, just the ruminating, cycling worry thoughts. And then certainly there can be a buildup of physiologic autonomic arousal that is a little more chronic, low level than the panic attack. But, people with generalized anxiety feel tense, muscle tightness, panicky, irritable, maybe panicky, irritable. They feel tense, and even kids. Kids, depending on the age, younger kids aren't necessarily going to tell you, "Oh, I'm really tense." They're, but they may just be irritable, and that you as a parent, you may be able to tell, "Oh, wait a minute, they've had a few.
They had to learn how to articulate it yet."
Yeah. They haven't learned to articulate it fully, but they're grappling with those kinds of things. So the take home point to me about that is not so much to get bogged down in the diagnosis themselves, but to just kind of, as a parent, you're really watching for, is it a psychological rumination, or is it a physiological autonomic reaction? And that's the starting point for a parent to begin to go, okay, what is this and what is going on here?
And how would you distinguish the difference between it being situational, or maybe there's a teacher that for whatever reason they always get in trouble by, and then versus like, hey, this is actually, maybe it's a biological disposition, and maybe you can talk some about that.
Yeah, that's a good that's a good conversation to have. And a lot of times, like, I would even say, like, the starting point for that conversation is to say, okay, you're beginning to get a sense that your child has some kind of, maybe some ruminating worry thoughts, maybe a little bit of, physiologic reactivity of that panic, and you're looking at it and you're going, well, gosh, that's definitely different than my other child, or my, you've got other kids, or that seems more. And then you begin to sort out, it's not really a disorder unless it's causing a disruption. If it's starting to disrupt functioning, and it's starting to disrupt family interactions, peer interactions, schoolwork, social development, then you're going to really start, your radar as a parent's going to go up a lot more. You're going to be like, okay, let's really investigate this and really start understanding what is going on here, because it is causing a disruption, and my efforts at soothing and reassuring aren't quickly, you may have a kid may have any of the symptoms we described for a day or two, and then it goes away and it doesn't come back and it's not a problem, then great. It's just normal development. You've reassured them and they've learned and they've grown and they've learned how to regulate their anxiety. That's normal development. But if it's a repeated pattern that's getting in the way of their functioning and their overall development, then you need to look a little more. And that's one of the things, what you brought up is one of the next things, I think, in your investigation as a parent. You're going, okay, what's the pattern? Is this only happening in this situation? Is it a very situational thing where there's something going on in the classroom, there's something going on, and that's definitely worth exploring then, and trying to figure out, well, what are the situational things? Because anxiety is a healthy, normal response, right? Anxiety, fear, we haven't talked about that, but fear is a healthy, normal response. And there may be things going on that are very situational, and that the anxiety response is a healthy, normal response that needs to be addressed in the social situation.
Right. It's protective in some regard. But I would say, what percentage of people that deal with anxiety, their thoughts are totally irrational, and then and then they're living in it as if it's a reality?
Yeah, and that's the next point for parents to investigate, is to explore that. Because when you start moving down that direction, and I don't know the percentages exactly, Tyler, but it would be like normative population, so please hear, when listeners are hearing that, when I say normal, I'm talking about a normative population from a statistical perspective. It's like, well, if you just look at the wide range, the vast majority of people are able to fairly quickly sort out, oh, wait a minute, I thought that was a threat, but it's okay, it's not, and they can regulate, and that's what we're wanting to help our kids learn, is to self-regulate and recognize what's a threat and what's not a threat, what's something that really needs to be addressed and what doesn't need to be addressed. But when you start to move down the continuum towards these more anxiety disorders, that's a hallmark feature. And a high percentage of kids and adults with these anxiety disorders have difficulty sorting that out. And it feels like it feels like irrational fear, and in the younger kids, because they may not developmentally be able to sort that out yet. So to them, it feels like a very rational fear. And then as a parent, it can be a challenge to help them understand that, look, we've taken you to the pediatrician 3 times and we're checking everything out and I'm right here with you. I promise you're not going to choke on that solid food. But the kid thinks it's a completely rational fear. And then all the way to in a little bit older, children and adolescents and adults, like I said, like the classic panic disorder. Most of the time after 1 or 2 panic attacks, people with panic disorder are able to go, I know that's not a rational fear, but it doesn't, but I can't use rational thought to control it because my body is just reacting all on its own. That's a good discussion for parents, because that's kind of what parents have to start like ferreting out and thinking about. It's like, okay, are we, we're addressing situational things. We're helping our child sort out safety and rational fears and what to do and how to regulate emotions. But yet we're still seeing a pattern here that's repeating, and it's starting to occur in multiple different settings. And it, to the parent at least, it's like, okay, this is not grounded in a rational fear or anxious situation. Now what do we do? And that's when you begin to start pursuing more of an evaluation and starting to look more into treatment options for your kids. And maybe that's a good place to talk. I mean, the first part of treatment is just good parent support for emotion regulation. And so you're just really working with the child and helping them learn good emotion regulation and helping to reassure.
Is that the first line of effort? Like you're meeting with the family and you're saying, listen, this is how I think we approach this.
Yeah, very much so. It's just to support the parents and support the parents. A lot of times parents in this situation just need some help understanding what's going on, and then some encouragement to trust their own instincts of how to reassure and support their child. And a lot of times it takes a lot of, of nurturing support, sometimes with a little push. It's nurturing support, but you do have to go to class, because if you, as soon as they hit this, that's the bad thing about anxiety, is as soon as you hit the escape button, then you just reinforce the pattern of escape. Oh, I can't tolerate this anxiety and I need to escape it. And I'm going to take the shortest route out. And that's to not go to school, or to not go outside, or to not eat any solid food. Yeah, right. And so that's what I mean by it takes a lot of nurturing support with a push on the back of, okay, we're here, but we've got to get through this. We've got to push through this. And that's the basis of good treatment. Now, there's other aspects.
Hard because as a parent, right? And you're like, when do you learn the balance of like, okay, I'll check you out of school today, or or no, you're gonna have to suck it up. And in some, I would say, like, you're not in your child's mind, so you don't know. It's like, how do they distinguish the difference?
Yeah. It's really tough. I mean, that's actually a great
I'd say prayer and discernment.
Yes, it does. It takes a tremendous amount of discernment, and it takes a lot of, like, to me, this is one of those examples. We've talked, I think, some about parenting, and if we haven't, we need to probably more about parenting and parenting styles. But basic parenting is finding that balance between the overly permissive and the overly rigid authoritarian, and it's called authoritative style. And a child with an anxiety disorder, you're going to, as a parent, you're going to feel like you're walking a tightrope, but of when you've become a little too
Yeah, those two
permissive,
guardrails just got a lot closer.
yeah, or a little too hard, that's why it's like, those kids need a lot of support and a lot of firm move forward and guidance. And so you're constantly trying to, like exactly like you said, well, it's like, okay, the child's clearly physiologically escalated and not able to get things settled down. And, hours of sitting in the counselor's office, the first time or two it happens might not be productive. And so maybe, mom coming and picking them up or dad coming and picking them up and, doing some things to get them grounded maybe is reasonable. But then at some point it's like, okay, then you've got to progressively, okay, I'll come and check on you, but you're not leaving school. I'll call you on the phone and talk to you until you're calm. And then the counselor is going to take you back to class. There's a progressive desensitization to it. But it takes a lot of discernment and a lot of, it takes
Wisdom.
Yeah.
The other question that I have would be, are there a lot of comorbidities with people that are dealing with anxiety disorders?
Yeah. Yes. There can be yes. If you're, because we haven't maybe even touched on that, like, when you're moving over on this area where really we're talking about a diagnosed, disorder, then you're talking about something that there is a fair amount of genetic predisposition and, family members with anxiety disorders, panic disorder, generalized anxiety disorder. And then it's in those family trees, a lot of times there is overlap with other mood disorders and, depression and those kinds of things. So there's definitely comorbidity in that regard with these things. But a lot of times that's over on one end of the spectrum. As you're more towards the middle of the spectrum, anxiety disorders are enjoyable to treat from a therapist and a psychiatrist standpoint, in that a lot of times with just some support of the parents and sometimes some cognitive behavioral therapy and support of the kiddos, they get a lot better, and they go on and, function great and do really well, and move forward without a lot of comorbidity. So,
is there, I would say, when is the trigger point where you would go a medicinal route?
Yeah. In the population of folks that come in to pediatricians and the population of kids that parents are just like starting to be concerned about these things that we've been talking about, I would, a small percentage of those kids would need medications. Now, if you've done all of those things and you're really still struggling and you're having, years ago, I treated a boy, probably fourth or fifth grader, I think, when he came in, and the mom was, kind of nonchalantly, saying, well, yeah, he's got panic and OCD. We haven't really talked about OCD much yet because it's an anxiety disorder, but it's also a separate thing. But anyway, it's still an interesting story, with this kiddo, because back then I was a young psychiatrist and I was like, well, at least give me a chance to do my thing, right? Let me interview and try to figure it out. ended up working with that family for a few years. Great mom, really good instincts, hugely strong family history, like multiple family members, large family, multiple of mom's siblings had this, and she was right. And it was a case that they had done a lot of things, and we did a fair number of, therapy things. Medicines, even in that case, was not the primary treatment, but there was enough genetics and biology at work that this little guy was really struggling, and it was disrupting his peer development and disrupting his academics. And we got him on a low dose of an SSRI. He responded very well to it. He was on it for 2 or 3 years and learned a lot of coping skills and was able to get off of it and go on his merry way. So there is a place for medications, but
it sounds like very rare though.
It should be rare in the broader population. I mean, by the time that they get to me, a lot higher percentage of kids that walk through my door end up on medications, and that's not because medicines are the only thing I do. I do therapy myself with kids. I work with parents. I try to avoid medicines. Our staff tries to avoid medicines. We have therapists here. But the reason why that is that a lot of these anxiety disorders that we're talking about that are somewhere in that middle ground do really well just with some support from the pediatrician and maybe seeing a therapist for even a few sessions of some cognitive behavioral therapy. And they don't come in to see us until it's a bigger issue. Now, if it's getting to be a bigger issue, find somebody, that's got more experience with it. And
well, a parent having a playbook on even how to, like you called it, like a, progressive desensitization. What'd you call it?
Desensitization. Yeah.
Desensitization. It's like, okay, that makes sense. Like here's what you can do in their specific circumstances.
Yeah.
And I think that's super helpful.
Yeah. And my experience with it a lot of times I guess I'm repeating myself, but like, it's worth mentioning just to encourage parents. Like, that's another reason why, like, on this bigger spectrum of anxiety that we're talking about today, one end is the more diagnosed DSM. Those are the ones that, yes, I will see those kids. And bring those, if you have questions, bring those kids in, we'll work with you, and all of that. But on this broader spectrum, a lot of times, just with support of the parents to begin to understand what the heck is this and what is the playbook, then they do fine. They do great with them.
Well, fantastic. This has been very informative. Are there any final words that you want to share?
I think mainly just, be aware of it. Like I said, there's real distress, I guess, is the thing. Really be aware that as we move on the spectrum over further and further in the more severe range, it can be very distressing for a child to have some of these anxiety disorders. And it's not, there's a point where we as adults in their world need to pay attention and go, okay, this isn't normal. We really do need to figure out some ways to offer them some help, because it's very distressing.
Well, I think today was a very helpful conversation for a lot of families, and some of my prayers that this video lands on the screens of the right people. But they can always call 573-334-7055 if they're interested in talking with some of your staff and making an appointment. They can visit us online as well at bradrobinsonmd.com. And thank you guys for tuning in for another episode of The Compass.